Hello, you're welcome to this channel. I am Dr. Sandra. I am a medical doctor and a surgeon. I am all about creating awareness and sensitization among my patients and the general population, especially about the different surgical conditions. Today's video is about arterial ulcers. Arterial ulcers are usually due to an obstruction, a blockade within the peripheral arteries that supply the peripheries, the extremities, the upper limbs and the lower limbs. These ulcers are commonly at the foot, the toes, the legs and the fingers most of the time. Inherently, these ulcers are deep ulcers, they are very painful, they are tender, and they are very chronic. They tend to take longer to heal. There is also a violation of the different tissue planes, the subcutaneous tissues, of course the skin, subcutaneous tissues, the fascia, exposing the tendons, the bones and the muscles. Usually when you look at this ulcer, it looks pale because of a reduction in supply of blood. There is also some greenish discoloration around the tendons. For example, if the tendons have been affected and there is a covering of pus usually around the tendons, especially if it is at the foot region. The commonest causes of these ulcers are arterial disorders or any other conditions that can affect the arteries. For example, in the lower extremities, we can have what we call atherosclerosis, that is deposition of fat plaques within the walls of the arteries. And this actually causes a narrowing of the blood vessels and a reduction in the supply of blood to the extremities, leading to hypoxia and then tissue death. We can have what we call thromboangiitis obliterans. This one, we don't have any deposition of fat plaques, but we have inflammation of the medium to small blood vessels, and it is very common in smokers. In the upper limbs, we can have what we call a cervical rib, where you have an extra rib that is actually compressing on the arteries that are supposed to supply your upper limb. And then you end up with what we call an arterial ulcer. You can as well have what we call Raynaud's phenomenon, where there is constriction of the blood vessels that supply the hands due to exposure to coldness, cold weather. You can also have what we call vasculitis, that is thickening and hardening of the walls of the blood vessels, causing narrowing of the lumen, and you can have a reduction in the delivery of blood to the different tissues, especially the extremities. And then you end up with an arterial ulcer. Arterial ulcers are usually an end stage of a given condition. Like I've told you, there are some things that can actually lead to an arterial ulcer. These conditions I've just talked to you about. I would like to give you the warning signs that you should look out for before you get the arterial ulcer, because it can be avoided. The moment you see these warning signs, please visit us, let us investigate you, let us diagnose you and manage you, because you're most likely dealing with an underlying arterial disorder. Number one, for example, you're trying to walk around, you're doing your exercises, and then you feel pain in the calf, pain in the buttock muscles. It is most likely that your arteries have a problem and you need to be diagnosed and be managed on time before you get to the end stage, which is the ulcer. You can also be having rest pain. You're not doing any exercises, you're not doing any exertion on your body, and then you end up with pain in the calf, in the buttock muscles. That is a warning sign. Please look out for that. You can also look out for loss of hair. By the way, you're supposed to have hair on our feet and legs. If you don't have hair on your feet and legs, please, that is a very bad sign. You could be having an arterial disorder. You can also be having shiny skin, which is thin, pale, brittle nails. If your nails are very brittle, they can easily break. It is a very bad sign that you could be battling a very silent, subtle arterial disorder that can actually cause an ulcer, an arterial ulcer. The other thing that you should look out for is darkening of the toes and the fingers. That is also a very bad sign. It is a sign that most likely they are not receiving blood because of an underlying arterial disorder which has not yet been diagnosed and investigated. We always do investigations for these patients. We investigate them using a lipid profile to make sure that you don't have an excess amount of fat in your blood sugar levels to make sure that you don't have diabetes mellitus, angiogram to make sure that your blood vessels are patent, no occlusions within the arteries. We also do a Doppler, arterial Doppler, to make sure that you don't have any obstruction. You don't have any clots within the arteries that are actually causing obstruction. The management of arterial ulcers is also debridement. We make sure that we excise all the devitalized tissues. We do cleaning of the ulcer with antiseptic agents, normal saline, and then we continue dressing the wounds. But if there is any gangrene of the foot, for example, of the toes, we do disarticulation. Of the leg, we do amputation because it is already dead. But we also have to manage the underlying cause. If it is diabetes, we have to optimize your sugar levels. But if it is an occlusion of a blood vessel, we always have to do what we call angioplasty, where we use a balloon to widen the lumen of that artery. If there is complete occlusion, we do what we call arterial bypass surgeries, where we use a graft to bypass that area that has been obstructed. These are my take-home messages to my patients and the general population. Please, when it comes to arterial ulcers, they can be avoided. And the only way to avoid them is to make sure that you don't get the conditions that cause these ulcers, the arterial disorders, like atherosclerosis, thromboangiitis obliterans. And these are the things that you can do. Please avoid smoking, avoid a sedentary lifestyle. You always have to exercise your bodies, do daily exercises to make sure that you're in a healthy weight for your height. Make sure that you have a very good diet, a healthy diet that has low fat within it. Always eat plenty of fruits, plenty of vegetables, whole grains, leafy vegetables. They are very good. They are very healthy for your body. Low fat is the game here, is the word for the game. Low fat in your diet is very good because you don't have to eat foods that are very high in fat. This is going to just compound on your atherosclerosis, deposition of fat within the walls of the blood vessels. You should also avoid stress. Always find a way of taking care of your mental health, because studies have shown that arterial disorders are also connected to stress. Please find a way of managing your stress. Take care of your mental health. It is very important that your mental health is at par when it comes to arterial disorders. yeah, that is what I have for you. By the way, there is not so much about arterial ulcers. That is what I had for you. Thank you so much for listening to me. Thank you so much for those of you that have subscribed to my channel. Thank you for subscribing. Thank you so much for liking my videos. Thank you so much for sharing my videos, for liking, you've commented. Thank you so much. Please continue liking my videos, continue subscribing to my channel, continue sharing my videos, and I will see you in my next video. Bye.